So I will start today's class. Good afternoon, everyone. In the previous class, we had discussed regarding Samiksha Bhavas of Panchakarma, what and all have to be taken care before we proceed to any Panchakarma for that matter, especially Shodhana. In today's class, we will be talking about Pariharya Vishayas. So, and now we have to take care of these Pariharya Vishayas before we start Panchakarma and also during the process and after the process also. These Parihara Vishayas are those which have to be followed all the time before, during and after the Panchakarmas. And it includes Ashtamahadoshakara Bhavas according to Acharya Charaka and do's and don'ts which are scattered. These do's and don'ts are scattered in Snehana, Svedana, Basti, Raktamokshana, Nasya, etc. So that is also included under Parihara Vishayas. And as mentioned before, these Pariharya Vishayas have to be followed before any Panchakarma, during and also after the procedure. So first let us talk about the Ashtamahadoshakara Bhavas as mentioned by Acharya Charaka. They are उच्चैर्भाष्यं रतक्षोभं विचङ्क्रमण आसने अजीर्ण अहितभोज्ये च दिवास्वप्नं समैथुनम्. So these are the Ashta Mahadoshakara Bhavas. If it were to cause simple problems, then they wouldn't have mentioned this. Hence, the word itself tells that they are Mahadoshakara Bhavas. And when we go through the symptoms, go through the chikitsa, we get a new dimension for this, which I'll be explaining in the next few slides. So, and also it is mentioned for each one of these bhavas, what will happen if this is done. For example, Uchchaihi Bhashyam. When a person speaks very loudly during any Panchakarma, or if he is habituated for that, for example, if a patient you are treating is a teacher or in a profession where he uses lot of his vocal cords, maybe singer or one who is in a profession where he has to speak loudly. So in such patients, if he is not following this Parihara Vishaya, then diseases of upper part, probably above Nabhi or Koshta, it is mentioned. Then Ratakshobha. If here Ratha, though it was during Charaka's period, Ratha was mentioned, which we can correlate to the two-wheeler or four-wheeler or three-wheeler also here. If he is traveling a lot during this Panchakarma, then diseases all over the body can occur. It is not that one day if he travels he'll get, but during the whole procedure if he is traveling, hence Panchakarmas are usually advised as inpatient treatment, right? So if he is traveling throughout the Panchakarma, like our OPD basis if we are treating, then there is a chance of Ratakshobha, and due to which few complications where a disease can occur any part of the body. Third is Ati Chankramana. If he is walking a lot during the process of Panchakarma, then diseases of lower part can occur as a complication. Then Ati Asana. We know that asana, it creates kapha in the body, and if there is Ati Asana, then this kapha prakopa causes diseases of the middle part. Then Ajirna. Ajirna in the sense, if during this period, if he is not following the rules which are mentioned, for example, they tell that Ushnodakopachari, right? So if he is not following that and he ends up with Ajirna, then there will be Amadosha, and this Ama can result in n number of diseases. Then Ahita Bhojana. We know that it is clearly mentioned that the food during this period should be asnigdam, that is which is not blocking the srotas. Then Ushna, it should be, just a second, I would like to add, yeah, it should be Dravam, Ushnam, Anabhishyandi, Nati Snigdham, Asankaram, and Ushnodaka is mentioned under Bhojana. This should be the rules that all these factors should be taken care. If a person or the patient is not following that and he is into ahita bhojana, then there will be dosha prakopa according to the type of bhojana he is consuming. Then divaswapna, we know that starting from snehapana till end, divaswapna is completely prohibited. Even during normal time, divaswapna is contraindicated except for grishma ritu. We know that. So divaswapna will be causing all sorts of kapha vikriti in that patient. Then maithuna will cause dhatukshaya. This is of importance because during this panchakarma process itself, there will be a small amount of dhatukshaya because of we know that during vamana or during snehapana, we are restricting the calorie. Hence, already there will be dhatukshaya to an extent, but by this, again there will be dhatukshaya. Hence, this is avoid. It is best to be avoided. Now, Acharya Charaka mentioned what happens if we do this. It is a wonderful thing to know. Uchchai Bhashyam, first point he is telling, there will be Shirastapa, Shankha, especially Shankha, Karna Nistoda will be there, Srotoroda, Mukha Talu Kanta Shosha is there, Timira, Jvara, Swarabheda, Hikka, Shwasa, especially related to Urdhva Jatru is mentioned here. Hence, almost all Lakshanas, they show that there is Vata Prakopa, right? And by looking at the Lakshanas, the treatment also is so beautifully framed, that is Abhyanga, Sweda, Upanaha, Dhuma, Nasya, Upari Bhakta Snehapana. After having Bhojana, Snehapana is advised because after Bhojana it is the Kafakala, and during that Snehapana, because that will bring down the Vata. Kshira is told, and last part is Mauna, because Uchchaihi Bhashyam is contraindicated, hence the patient has to avoid loud speaking. See, this, though this is under the Pariharya Vishaya, this can be considered in patients who are professionally into teaching, singing, professional singers, etc., where Uchchai Bhashyam we can see, and uh, in profession where vocal cords is majorly involved, and in them we can advise all this Abhyanga, Sveda, Upanaha, etc. So that is one important message we can take from this. Second is Rathak Shobha. This Rathak Shobha we can now consider in the present scenario, traveling a lot in two-wheeler, three-wheeler, and four-wheeler. He tells the Lakshana, if it is done, the Lakshanas are Sandhi Parva Shaitilya, Hanu Nasa Karna Shirashula, Kukshik Shobha, Atopa, Antrakujana, Sandhi Skanda, Griva Daurvalya, Anghavitapa, Padashota, etc. So again, by these Lakshanas, we can say that it is Vata Vruddhi again. Hence, the treatment mentioned is Vata Shamaka Ahara Vihara and Aushadha, Snehana Svedana, and avoid other Vatakara Nidanas here. And exactly, people who travel for work daily, they will have all these lakshanas, right? Maybe in the form of Katishula or Gridrasi or Apabahuka, Vishwachi, etc. So in such individuals also, the same chikitsa has to be adopted. Then coming to Atichankramana. The lakshanas mentioned here are Shula, Saktisada, Nistoda, Pindikodveshtana. We come across so many individuals with this Pindikodveshtana nowadays. Angamarda, Amsabitapa, Siradhamani Harsha, that is, there will be restlessness, and Shwasa, Kasa, etc. So, what here also the main dosha involved is Vata. Hence, the treatment mentioned is Vata Shamaka Ahara Vihara Aushada Snehana Svedana, avoid Vata Prakopaka Nidanas. Next is Ati Asana. We know that, see, this picture clearly tells that what Ati Asana does. Neck gets tense and tight, trapezius muscles get strained, discs in lower back begin to bulge, hips get weak, knee pain develops, then sciatica develops, feet becomes flatter. So, what is mentioned in Ayurveda? Spik parshva vankshana kati prishta vedana. Is it not the same? Though it is mentioned as parihar under the heading of Pariharya Vishaya, Ati Asana, if it is done even during normal circumstance, also will cause the same lakshana. So now in professions where prolonged sitting is there, we can advise the Vatahara Ahara Vihara Aushada to prevent all these um, complications, that is disc bulge or else sciatica, etc. We can advise Vatahara Ahara Vihara Aushada before itself, before the patient gets the complaints. Now coming to Ajirna. So, ajirna happens when a patient is not consuming food according to ahara vidhi. That is, before the previous food gets digested, if he consumes the next ahara, or else if he is not considering the Trivida Kukshi concept, if adhyashana is done, that is, um, matra is not considered properly, then there will be ajirna. So, what happens? See here, when we see go through the um, symptoms of indigestion, we can see that there is bloated stomach, heartburn, abdominal pain, nausea, vomiting, flatulence, growling stomach, constipation, diarrhea. Both can happen. Burping, acidic taste, loss of appetite, morning sickness, etc. So, the same has been mentioned here even in Ajirna. Mukhashosha, Adhmana, Shula, Pipasa, Gatrasada, Chardi, Atisara, Pravahana, Amavisha, etc. This undigested food in the intestine itself becomes Visha here. Uh, Maybe food poisoning we can call, or else some metabolic disorders where the um, food itself is turning as a toxic material. And in such condition where ahara vidhi is not followed, charaka advice, Vamana is a line of treatment. Svedana to Koshta, Udarashula if it is there. Langhana. Langhana can include the Chatush Prakara Samshuddhi and also the um, Pipasa, Maruta, Atapa, Upavasa, etc. Deepana and Pachana Dravya Prayoga to clear the ama which is present. And Ahita Bhojana. We have a list of food mentioned as not to be consumed regularly. But if we go on consuming such food, then it is called as Ahita Bhojana, and that will turn mm, into Amadosha, and there will be Aruchi, Durbalata, Vaivaranya, Kandu, Pama, Gatravasada. See, this is not something which happens in 1 or 2 days, because Grahani, Arshas, etc. is mentioned. For the pathology of this to happen, it takes quite some time, right? So it is not something which is acute. There are these few lakshanas what they mentioned here are long standing also. If a patient is involving in ahita bhojana after panchakarma, during panchakarma, before panchakarma, then there are chances of that patient getting into grahani or arshas. So what is the treatment now? Change in lifestyle, that is, he has to change the way he is consuming food, change the way he is uh, keeping himself active, then sleep, etc. Everything has to change. Then he has to follow ahara vidhi. Here ahara vidhi refers to um, the in Vimanasthana, whatever Charaka has mentioned, that is Ushnamashniyat, Snigdamashniyat, Nati Dhrutam, Nati Vilambitam, then Tanmana Bhunjita, Atmanam Abhisamiksha, all these has to be taken care. Uh, if a patient is consuming Ahita Bhojana, he has to follow the Ahara Vidhi mentioned in classics, then he can overcome these symptoms. Then coming to Divaswapna. Divaswapna is completely contraindicated. We know that, right? So, if he is doing this mistake, then he might end up with Arochaka, Avipaka, Agninasha, Stymithya, that is a feeling of cold as if a wet towel is covering the body. Then there will be Pandu, Kandu, Pama, Daha, Chardi, Angamarda, Hritstamba, Jadya, Tandra, everything related to Kapha Prakopa, right? Kapha Vriddhi. Talulepa is also there. Then in such individual, see why Hritstamba has been mentioned. Probably when a patient is continuously doing this Divaswapna, the Kapha which is in Vruddhavastha may block the channels, srotas of Hridaya. Hence, there will be Hritstamba due to the Srotoroda to the channels related to Hridaya. There will be Hritstamba. And for this, Acharya Charaka mentions Dhumapana, Langhana, Vamana, Shirovirechana. See, the beauty is directly they are mentioning some kapha, that is apatarpana chikitsa here, that is Shirovirechana, and then Vyayama, because it is the kapha vruddhi stage. In previous all mistakes, it was the vata which was attaining prakopa. Here it is the divaswapna. Hence, they have crafted the chikitsa accordingly. That is, vyayama has been mentioned. Then ruksha annapana to overcome the kapha. Then arishta has been mentioned. Deepaniya dravya prayoga, pragharshana, unmardana, parisechana. If you want to get the different types of massage which are explained in Ayurveda, this is one such reference where Pragharshana is using of just like Udvartana, using dry herbs. Then Unmardhana, with lots of pressure, we are making this massage. Then Parisechana, using of dravyas which are rukshana in nature, for example, Trifala Kvata. So, according to the dosha prakopa in this, the treatment has been framed. Then the next point here, we know that already due to the panchakarma, the strength is little less. And in spite of that, patient is involving in maithuna, then there will be sudden loss of strength. Urasada, Shirashula, pain in urogenital region, Hridaya Spandana, Angashaithilya, Kasa, Shwasa, etc. These all lakshanas are due to Dhatukshaya only. Hence, Dhatukshaya leading to again Vata Prakopa. The treatment is also explained in the same way. Jivaniya Gana Prayoga with Kshira and Grita. We know that Jivaniya Gana Dravyas, they will improve it improves the Rasa Dhatu and the Uttarottara Dhatus, and Vata Ashamana Chikitsa has to be followed. Basti, then Vidari Gandhadi Siddha Kshira is also advised in this. So next we have along with that this Ashtamaha Doshakara Bhavas, this is one of the thing told as which has to be avoided and which has to be consumed. First point is Ushnodakopachari. Throughout the procedure, Ushna Udaka is the best for all sorts of activities, maybe for drinking, for snana, for hand wash, whatever. Ushna Udakopachari is best. Syat Brahmachari Kshapashayaha. He should remain Brahmachari, and also he should not sleep during daytime. He should sleep only during night. Then Shakrat Mutra Anila Udgara Anudirnashchan Adharayet. He should avoid controlling the urges, especially Shakrun, Mutra, Vata, and Udgara. These natural urges have to be attended. It should not be like dharana should not be done of these four vegas. Then vyayama has to be avoided. Uchchaihi vachanam. We previously saw that Uchchaihi vachanam, Krodha, Shoka, Hima, Atapa. Better to avoid getting exposed to Hima and Atapa. Then Varjayet Pravatam cha Seveta Shayanasanam. It is better to avoid breeze when sleeping and sitting. So This is mentioned in Charaka Sutra Sneha Adhyaya. Though mentioned under that, Vagbhata opines that Sarva Karma Swayam Prayo. This has to be followed in all karmas, whether it is Snehana, Svedana, Vamana, Virechana, whatever karma you are doing, please do follow this without hesitation. And we can clearly see here that few of the Pariharya Vishayas are Ahara related. Vagbhata also mentions here the food should not be uh, anabhishyandi. It should not be abhishyandi in nature. Nati snigdham. Though snigdha, it should be snigdha, but it should not be nati snigdham. Then mm, dravam. The food should be drava ushna. So few things are related to ahara. Few are related to manasika things like even in vihara we have sharirika and manasika like brahmachari, then kshapashaya, vegaroda, vyayama, swapna, yana, etc. Atyasana stitihi, exposure to hima, atapa, pravata, dhuma, raja, etc. These are all viharas under sharirika bhavas, and vihara which are related to manasika bhavas are avoiding krodha, shoka, etc. So we can divide this into three parts. First is aharaja and viharaja. Under ahara we have dravam, ushnam, nati, snigdham, anabhishyandi, ushnodakopachari, etc. Then under vihara we have two headings, sharirika and manasika. Sharirika are all these brahmachari, kshapashayaha, veganna dharayet, then not getting exposed to pravata, etc. Manasika we can consider it as not involving in krodha, shoka, etc. So, in brief, Parihara Vishas, whatever is mentioned in different texts, we can uh, take it in just like excessive sitting, standing, walking, speaking, riding, whatever may be the activity, excess is not allowed. And Diva Swapna, of course, then we should not suppress natural urges, especially they have told Shakran, Mutra, Anila, and Udgara. These four, of course, other Vega should also be expressed, but they have mentioned these four in specific, and no cooling regimens. Stambhana Chikitsa or Pittahara Kriya is strictly prohibited because we need Agni to be Pradipta during Panchakarma, and not to expose oneself to sun, wind, etc. And also not getting involved in grief, akrodha, shoka, bhaya, etc. Then avoid intake of unwholesome food and untimely food, that is adhyashana, hita bhojana, etc. This is in brief. When we pick from different samhitas, we can summarize as follows. Then is Parihara Kala. How long this should be followed? So, um, Charaka in Siddhisthana, he mentions that we should follow this restriction double the period that is required for the procedure. For example, if Vamana, whole procedure of Vamana, if it has taken 10 days, then this Parihara Kala should be done for 20 days, double the period, 20 days. So, completely 1 month. And after Snehapana, Laghu Bhojana up to 7 days. After Vamana up to 7 days. Then Rakta Mokshana up to 1 month. Parihara Kala should be observed. Basti 3 days. And apart from this, there are scattered references which tells that um, it this Parihara Kala should be extended Abala Labha. That is, till the patient gets strength and Agni is restored. This is according to Dalhana, where he tells this Parihara Kala should be um, extended up till the patient gets strength and his Agni is good. And this is for in general. When we see through different contexts, like different references, in Acharya Charaka tells Svedana, one day it is better to avoid Vyayama, that is on the day of Svedana. If Sarvanga Svedana is done, that day Vyayama is strictly prohibited, and or till he gets the strength back, it is better to avoid Vyayama. So, such scattered references are there in classics. Then after everything is done, that is after learning about uh, Ashtamahadoshakara Bhavas and Parihara Vishaya, and how long it has to be done, that includes three type of sarjana. In the previous class, we mentioned only two. Actually, it is three. First is Peyadi Samsarjana. This is the reference where it tells Peya, Vilepi, Yusha, and Mamsarasa. Under Yusha, we have Krita and Akrita Yusha, and Mamsarasa also Akrita and Krita Mamsarasa. This is usually when we understand the Vamana Phala, that is after Vamana, if we calculate the Sneh, the Vaigiku Shuddhi, Maniki Shuddhi, Laingiki Shuddhi, etc., then we decide which Samsarjana Krama has to be followed. Then if there is Vata, Pitta, Adikya, we go for Tarpanadi Samsarjana. And if there is a lot of Vata Prakopa and Dhatukshaya is there, we go for Rasadi Samsarjana. This is done during the Parihara Kala. So, what is why it is important to learn about this Parihara Kala? First, we know that our prime motive is to remove disease from Mula and maintain health, right? When we decide this Panchakarma has to be done in this patient, our only motive is to see that that roga is cleared from its mula, and the swasthya will be retained in that patient. That is our first motive. Then, keeping that motive, if we are not following these pariharya vishayas, then if it is not done properly, it causes more damage. We are not treating the disease, but we are creating new, and it also we are creating many more complications sometimes which cannot be treated properly. For example, jivadana, we know that that is one of the vyapat, right, where rakta srava will be seen. So here we are, if the patient is already anemic pandu, where we are giving shodhana and we are not taking care, that jivadana itself may prove very fatal to the patient, and also it's very difficult for the physician to manage that. Hence, this Pariharya Vishaya gains importance in preventing complication, and it may bring about undesired effects in the patient and in the course of the disease. We do chikitsa to do samprapti vihatana, right? But by our chikitsa, we should not create one more disease in that patient, and instead of bringing down the samprapti, if we are creating desirable means undesirable effect where many more vyadhis come and it becomes a vyadhi sankara, then it's very difficult and it's very unfortunate. So this parihara vishayas have to be taken care during panchakarma. And why do we need to, like, what is the need for understanding this? First is, during Parihara Kala, we take care that the patient receives sufficient nutrition. It is because, say, we know that during this Panchakarma, we restrict the calorie. Hence, there will be calorie deficit. And during this Parihara Kala, we take care of the nutrition. That is the first motto of this. Second is it promotes sweating, because we see that Ushnodakopachari and he is not getting exposed to Pravata, etc. It promotes sweating, hence there will be no Srotoroda. It brings Agni to normalcy, because the way we start the food, like first it is Peya, then it is Vilepi, then it is Yusha, then it is um, Mamsarasa, or else normal food. Hence, it is a gradual process of introduction of the calorie. Hence, Agni, if we see that Agni comes to normalcy. And due to the procedure itself, patient might have lost strength. Not to a greater extent, but of course, due to Vamana, Virechana, etc., the strength will be little less. Hence, this Parihara Kala, it helps to regain strength physically and mentally, and it helps to overcome stress and weakness. Uh, why we are discussing this? See, um, Panchakarma is a process where we are interfering with the normal physiology of the body. We see that we restrict normal food, we introduce fat, diet during Snehapana. And during Vamana, on the day of Vamana, we are giving medicines which is forcefully acting on the stomach and its contents. During Virechana, forceful expulsion of doshas, malas, etc. to the through the anal canal. So something uncomfortable thing is happening in the body. Hence there will be a lot of stress physically and mentally, and this is not a comfortable process as such. Hence there will be lot of physiological changes in the body, which has to be taken care. So next, this practical applicability. How are we going to use this information? First is, we know that disease related to lifestyle or just increasing day by day, right? So for example, we see that ajirna hita bhojana, it is leading to so many diseases. The information what we have under the heading of ajirna and ahita bhojana here can be applied there also. And second point is, we know that sitting is the new smoking. This is a concept where um, excessive sitting is related to, they have found that this sitting is causing lot of cardiovascular disorders, then circulatory disorders, and obesity, metabolic disorders, etc. And in such cases, whatever chikitsa mentioned under ati asana can also be applied. And when we go through the metropolitan cities, how they are working, there is lot of traffic, and we get n number of patients who are having all these asthimajjagata vikaras or else musculoskeletal disorders. The same chikitsa which has been mentioned for ratakshobha, ati chankramana, etc., ati asana can be uh, advised in all these musculoskeletal disorders, I feel. Then we have, in cities we have this night and day shift, where uh, people working under night shift, they come and sleep in the day, and people who have second shift, they come late and they get up late. So though it is depending on the profession, but still body will have the complication depending on the dosha prakopa, right? Hence, to avoid that, to combat those diseases which are resulting due to this, we can treat the same way how they have mentioned it under divaswapna. Okay, so this is the practical applicability of this pariharya vishayas. Then how it is helping. First thing is, see, when we are doing this panchakarma, there will be lot of dehydration and electrolyte imbalance, because it is seen that after svedana, if we check blood, sodium chloride level will be very less, and potassium levels are increased. And even after vamana, the sodium, potassium, and chloride level will be less, and serum calcium level is high after vamana and also virechana. So there will be some electrolyte imbalance, not to the extent of them causing any disease, but surely there will be some imbalance. And we know that by vamana and virechana there will be a lot of dehydration. Hence we advise then peyadi samsarjana to take care of that hydration. Then correcting stress. This stress, it is because our body reacts to anything which is uncomfortable and unfamiliar situations, physically and psychologically. This vamana, it's not a comfortable procedure at all. Virechana is not comfortable procedure. Then nasya, it's not comfortable procedure. Basti is not comfortable procedure. So that will be causing a level of stress physically and also psychologically. Hence, we need this parihara kala to overcome that stress. Then we are correcting inflammation. They see that after vamana, that is after 5 minutes of vamana, total leukocyte count was increased, um, because of the medicine or the process. Okay, so to take care of that local inflammation or a temporary inflammation caused due to that medicine or the procedure itself, we need time. Hence, this Parihara Kala will help you reduce that inflammation. Then we are going to restore this gut flora. It is because by Vamana and Virechana, we are clearing the bacteria which are disease causing, but along with that, gut friendly bacteria will also be removed. Hence we need some time to restore that gut flora. And we know that this transition, it is because we are shifting from fat diet to calorie diet. That transition is causing ketosis in the body, where liver has to compromise. First, it was only fat diet, and then gradually we are introducing it to calorie rich or carbohydrate rich diet. Hence, that transition period cannot be very instantaneous. It should be very slow and also guided. Hence, this Parihara Kala will help the body to adjust to that transition and change. So this is all about Parihara Vishaya and Pariharya Bhavas, which has to be carried out during Panchakarma, and few of them after Panchakarma also. So if you have any doubt, let me know.